Welcome back. So, the likes of, for example, BPO companies, you would go in there and you would actually offer the product here together with other companies that are giving medical packages for each one of the members of the BPO. So you have to be, in order for me to access this, I would be part of the company's healthcare package?
Typically, yes. A large call center would have a benefit package for their employees, one of which could offer the option for telemedicine for themselves and potentially their families. The family is a big issue, important thing for that.
So MyDocNow would be available.
That's correct.
Okay, and then how would you actually access? You have an app here.
This is an interesting app which we will be putting on the market soon, which I call Hospital On in Your Pocket. So, for example, you can call us and talk to a doctor. You can call Lifeline and the doctor can come to your house, or a nurse come to your house, or your lab results to your house, or you can order medicine through this app. Or if there's an emergency service, you can press a button.
And this would be available shortly. This is not available yet.
It's actually on the Google Play Store, and we're putting it on the Apple Play Store, and then it will be available. Mainly focused with Lifeline and their client base.
Right. So for companies, so we'll go to the one of these social inclusive, but for large companies, for those who would actually include telemedicine in there, you're tied up with which hospitals or?
Well, we'll be starting with DeVal Doctors Hospital shortly, and once we're through that experience, we'll begin to expand out to the Metro's hospitals here in the.
So you're starting with DeVal.
That's correct.
Yeah, excellent. So, Doc,
yes,
we were talking earlier about personal CSR, social inclusive growth, and one of the main problems really is healthcare or the inaccessibility of healthcare.
Correct.
How can this help? Is there like a CSR part to MyDocNow?
Yes, there is.
In reaching the bottom of the pyramid.
I made it very clear from the very beginning when I joined the group.
Yes.
Okay, that my personal mission here was to provide every Filipino with access to a doctor. This is the answer. Okay, this is the answer. I know it because ever since cell phones were invented, like in the 90s, I knew that this was it. This is how to get in touch with patients. If we talk about the practicing telemedicine, ever since I had a cell phone, I've been practicing telemedicine. Okay?
You were just not institutionalized yet.
Yes.
For that,
And for the sake of the other doctors, every time I give advice or I get consulted, I don't get paid.
Yes.
Okay? Because there was no...
there's no system yet.
Yes, no system. Now for other doctors who are interested, we have developed that system, okay, of getting paid. Now, I want to push it to another level, to the level of PhilHealth, okay? Because PhilHealth can actually adapt it, okay? If they're looking for solutions on how to reach every single Filipino, it's through telemedicine. There's
one
no
doctor
other
per
way.
barangay. One doctor.
No, not one doctor. A cell phone. A cell phone, maybe one per family. And we do have that. We have 104% cell phone coverage in the Philippines. 104%. And anyone with one can actually contact us. Okay? Or if we apply it in the PhilHealth setting, every family with a cell phone is connected to the PhilHealth system.
So are they open to do this?
Well, we'll have to. I know they're talking about it. They're planning. They have a person in charge of it. Is it rolling out now? No, not yet. No?
But this is the
I would like to
future.
tell them, please, no, let's sit down, let's
Yeah.
talk about it, because every time every day that we don't implement, or every day we don't start implementing, people are suffering. No? Mothers are dying.
We're more than 100 million Filipinos.
We're about 104 million now. I
Yes.
think. Our maternal mortality rate is still high. Our infant mortality rate is still high.
Yes.
You know, this month of June will be in Aurora province, focusing on pregnant women. I think we're going to see 4,500 of them, and children below 5 years old. No?
Yes.
And we're going to offer this package to them, no? to 3 towns in Aurora. No?
So let's say with that
just
one,
to show,
how do you offer to them? How much do you tell them, all right, download this app and you can get access to your $100? How is that going to work? And how much do they pay?
Okay, that's a very good question. Essentially, as Mike has said, we have to work within the existing cellular system. So a typical consult would be a patient would want to talk to a doctor. They text our call center. Okay. The nurse gets the text. She will call the patient back on a cell phone, take a medical history and complaint, and then arrange for a doctor to call them back on their cell phone. So the central point of contact is our call center that goes out to the doctors who arrange to call back. So as Mike said, if you have coverage, you have access to a doctor. The next element is we are working with what I call social enterprise groups, microfinance groups that have a large number. Network, exactly right. And our initial proposal was charging their members 20 pesos a month, which is really in the affordable range.
Yes.
And they then have access, they and their families, to a doctor. Now, from a business standpoint, obviously, we're working what I call the insurance model of business, where you insure a large number of people and you have statistically less usage.
Yes.
So from our perspective, it could be an attractive business model, or is an attractive business model, and we provide service. In addition, we're mating that process to medicine. A consult without medicine, in many cases, is not a viable relationship. So the microfinance will be setting up health savings accounts, so they have some money to buy medicines, and we're working with some major pharmas that will provide a distribution point for medicines in rural Philippines. So if a doctor determines that you need some medicine, they will write the prescription to our nurses. The nurses then will email it to a local pharmacist that someone they can go in and pick it up.
Does that mean you also lower the cost of medicine by doing this?
Yes.
All right, we're going to continue this discussion. We're going to cut to a short break. You're watching BizNews. We'll be right back.